This presentation describes the use of a simulation model to assess and improve operating practices in an orthopedic setting. I'm Brent Sell. At Hipkins Hospital, there are 2 orthopedic surgeons who each complete 4 to 5 surgical cases each day. The cases are all hip or knee arthroplasties. The hospital and the surgeons would like to increase their productivity to 7 cases per surgeon per day. The other key goal of changes will be to improve patient satisfaction. Here are my recommendations to improve productivity and patient satisfaction. They were derived through the use of AnyLogic simulation models. Number 1, the hospital should increase the number of anesthesia providers to 4 for the 2 tracks. A pooling process should be used to assign anesthesia providers to cases. The inter-arrival times for patients should increase from 90 minutes to 120 minutes. The practice of postponing or canceling scheduled cases should end. The number of cases that can be completed each day should be determined in advance, and only that number should be scheduled. Staff must be appropriately incentivized to finish all scheduled cases each day. The hospital should also consider using physician assistants in a fashion that will effectively decrease surgical times. The patient needs to always remain at the center of our efforts. What does the patient want? A successful procedure, no complications, to be treated with kindness and respect and convenience. That actually aligns very well with the desires of surgeons, anesthesiologists, and OR staff. But surgeons also want maximum productivity. Anesthesiologists and OR staff want adequate staffing to preclude excessive stress and burnout. And the hospital needs maximum revenue and net income, as the OR needs those resources to provide for the rest of the institution. Current procedures and parameters in use. There are 2 identical tracks, A and B. There's 1 surgeon in each track. There's 1 anesthesiologist in each track. There are 2 dedicated operating rooms for each track, and they both work a 10.5-hour workday. Current procedures and parameters that are in use also include 2 registrars working together in a pool for patients in both tracks. There are 2 environmental service workers who work to clean and restock all 4 ORs used in both tracks. If the other policy is that if it is anticipated that a case can't be completed before the end of a 10.5-hour day, the case is canceled for that day and postponed to a later date. First step in analysis is determine the key performance indicators. The net income is the first. That's very difficult to estimate, so I'm going to use a proxy of the total number of cases done as a proxy for net income. The utilization rates for each process needs to be evaluated. Staff satisfaction and turnover are concerns, as is patient satisfaction. So again, this just describes that I'm going to use the number of cases as a proxy for net income. We will also look at patient flow times and utilization rates for the different personnel involved in providing care. Anesthesia services can be provided using different staffing models, staff anesthesiologists, nurse anesthetists, as well as anesthesia residents. The cheapest way of providing care is using anesthesia residents, but there aren't enough residents, so there's various combinations that are used. But I will not go into that in this analysis. Skilled surgeons are scarce and expensive. I will not attempt to make any change in the number of surgeons that are used in this process. The registrars and environmental services personnel are generally low cost and easily recruited. The initial evaluation of their utilization was low, and their services can easily be shared with other services in addition to the total joint replacement service. So the initial values that were obtained with the baseline parameters, 4.2 cases could be done per day, and the flow time per patient was about 200 minutes. In 15% of the trials, 1 additional case was less than 10 minutes from being completed when the trial ended. If those were allowed to finish, the total would be 4.4 cases per track per day. Baseline values for utilizations are shown. Anesthesiologist utilization was the highest at 85%, and in some cases in simulations it approached 97%. That's a number that's too high and will not be sustainable. The effect of changing inter-arrival times, the number of cases per day does not change significantly, going from 4.2 to 4.3, but the flow time decreases by about 25%. That's significantly improvement and should definitely be considered. The effect of pooling the 4 anesthesiologists does have a significant increase and increases the number of cases up from 4.3 up to 4.8, so about a 10% increase. The flow time does not change significantly. The effect of adding 2 physician assistants, the number of cases doesn't change and the flow time doesn't change, so that makes no significant changes in the success. The effect of adding 2 physician assistants, if they are used appropriately, that is, they prep, position, and close the wounds for cases and allow the surgeon to move on to more cases, they effectively decrease the operative time by about 40 minutes, which increases the number of cases per day that can be done to 6 cases per day. Flow time stays about the same at 130 minutes. Decreasing the number of environmental services and registration personnel doesn't change the number of cases or flow time, only increases their utilization rate slightly. Conclusions. The hospital needs to increase the number of anesthesia providers to 4. A pooling process should be used to assign anesthesia providers to cases. The inter-arrival times for patients should increase from 90 minutes to 120 minutes. This may need to revert if surgical times decrease substantially with the use of physician's assistants or other methods. The hospital needs to cease the policy of postponing or canceling scheduled cases. The number of cases that can be completed should be established in advance, and that number should be scheduled each day. The staff then needs to be appropriately incentivized so that they want to stay and complete those cases. The disadvantages of canceling certain patients and sending them home after they've been waiting all day needs to stop. The hospital also should explore the use of physician's assistants in a fashion that will effectively decrease surgical times. This will help increase productivity. That's the end of the presentation, and I'm glad to answer questions. Thank you very much.